I want to address the board, contract agencies, and public tonight to make clear that I've heard the concerns of the county commissioners and wanted to respond to those issues. I believe we've done some amazing work together over the years, the board, agencies, commissioners, staff, and our consumers and families in both treating and preventing mental illness and substance abuse addiction, and that has worked because we have listened to each other. I had responded positively to a request from the county commissioners to meet, but was not given that opportunity before these issues were brought up on Tuesday. I want to clarify some of the misinformation that has currently been published and reported. First, I want to make it perfectly clear that we did not cut programs or services in Geauga County after our levy renewal passed and our new levy failed in 2012. In fact, we've increased many programs, including an increase to the number of the beds in both the Crisis Center and the Transitional Living Center, and the opening of the new supported living facility. We have also increased services to children in a grant to Catholic Charity Services and increased funding to Lake Geauga Center for Drug and Alcohol Services. In total, the board has awarded an additional $1,905,242 in new funding just since November of 2012. All the while maintaining ongoing programs and services, none of which were cut. Those dollars, in large part, were due to increases in grant funding that the board staff has been successful in drawing down to this county just since the fall of 2012. We've also made it clear to agencies that as we enter into our new fiscal year on July 1, we expect additional resources will be made available as healthcare savings continue to increase in this community. Second, I'd like to address the staff salaries that have been called into question. Pay raises were based on salary surveys of other boards, other behavioral health care agencies, and the county-approved salary schedule for the Geauga County Department of Job and Family Services. Pay scales approved and provided by Geauga County, by the Ohio Association of County Behavioral Health Care Authorities, and requests for proposal submissions by local agencies showed that board staff were, in fact, on average, making significantly less than individuals doing comparable work. That was due in part, I believe, to decades of history where other departments and agencies may have offered a merit raise and then a step raise in addition for years of service. That has never been true in this office and was part of the reason, I believe, for some of the ongoing discrepancies in salaries. After 2 years of no pay increases in state fiscal year 2010 and 2011, the staff got 3% raises in state fiscal year 2012 and 6% in 2013. In state fiscal year 14, those raises went to approximately 15% with understanding of the staff and the board that those would be set for an additional 2-year period of time. So over that 7-year time frame, the average raise within the staff is 2.86%. Finally, I'd like to address my own salary. In August of 2012, the board and I entered into an agreement that covers a 3-year period of time. In that agreement, I requested of the board a 1% increase in year 1, a 3% increase in year 2, and a 3% increase in year 3. That was after my previous contract of 3 years, where I requested no raises at all. The board agreed and the contract was signed. That was the extent of my request. Later that same year, the board received additional information on a statewide salary survey of boards and requested me to provide them with additional information on staff and community salaries as well. After months of review, I believe the board felt that data showed that I was not compensated to the level of other board directors with the same experience around the state and passed a resolution which would increase my salary based, I believe, on 26 consecutive years of excellent director evaluations and the ability we share in bringing new dollars to this community. The resolution to award consecutive merit raises of 15% was humbling in this board's show of support to me and tragic at the same time. I know it was not your intent as a board to do anything that would harm the critical care we have created and you have supported, and which you have supported with your time and talents for so many years. And I share that concern that my work on behalf of individuals with mental illness and substance abuse disorders not be diminished for the same reason. While I believe the increases implemented were well documented and warranted, I understand the county's concern with remaining within salary line item constraints. In order to do this, we will need to make adjustments to our salary appropriation. Therefore, I am requesting the board revise their resolution and lower my salary back to my previous contract levels reduce the previous raises to the staff to July 30th, 2013 levels, and reduce or eliminate the vacation and sick leave buyback provisions of the board policy, which fluctuate from year to year and have an adverse effect on the salary line in the county budget. I believe these changes in addressing the challenges together will continue to create a quality of care in Geauga County that is next to none. I expect that this time next week, this board will be receiving its 3-year Culture of Quality certification from the Ohio Association of County Behavioral Health Authorities. We are only the 3rd board in the state to receive this designation for the highest level of care 3 times. We have a history of quality work, not without some bumps in the road along the way, but with quality, which means ultimately a healthier life for Geauga County citizens.